Monday, week 2 mobility routine. Today, we're going to need a tennis ball, roller, or a bar, mop handle, anything that's about 18 inches to 2 foot in length. And then we're going to need a compression band that we're going to do an overhead banded distraction with. So if you don't have the access to a pull bar or some sturdy pipes in the basement or something like that, maybe you have a bed frame or anything that you can strap this over that you'll be able to wrap your elbow in and around the strap and then be able to pull it back. So the first thing we're going to do is the overhead banded distraction. So we're going to come back here, take our elbow, put it in the strap, wrap our hand back around the strap, start our 2-minute timer, and then we're going to step out and in. So one of the things you see that I'm doing is I'm pulling my elbow into my head as it sets the shoulder back into the socket. Sometimes I'll step a little bit more further forward so that I can get a little deeper pull back in. For those of you that have bad shoulders, this could be a little painful as you try to reset that socket back into the shoulder where it's supposed to be. And then I will switch, go a little deeper. Again, trying to keep that elbow close to the head. You don't want it flying out like that, as that puts pressure on the shoulder socket that we're not looking for. Try to set it straight back and in. Probably somewhere about a minute and a half, you'll start to feel your fingers tingle a little bit. Or at least I do. Yep. Continue to breathe. Now, if you have a stable squat station or something like that, if you've got a nice gym at the house, you can set the band up on that. You can actually go down on your knees and do this sitting on your knees. In a couple seconds, we're going to switch sides. And let's switch. Again. I'm going to make sure we wrap that band back and around that elbow. Wrap our hand around that band. I want to make sure that thing doesn't slide up and off your elbow. And then we're going to set 2 minutes. Again, bring that elbow into the head. Set that shoulder back into the socket. And I'll switch around. Try to let that band pull that shoulder back in. Again, don't let that arm fly out like that. That is not what we're looking for here. We want the arm stable. That's why we're holding on to the elbow like this. About 20 seconds. And then we'll move on into the other room where where I have a little bit more room. So we'll take a pause here, get set up to finish the last two of the mobility routine. There we go. 2 minutes on each side. Take your time. You may have to shake your shoulder out a little bit. We're gonna make a quick move to the other room here. Okay. For the next one, we're gonna do the forearm smash. So for the forearm smash, let me set this so you can get a better view of this. You're gonna take your hand, place it in the mat. We're gonna take the ball and we're gonna roll up and down the forearm. You wanna make sure you put pressure on it. Here we go. 2 minutes. So you wanna roll it around. Ooh, at the top section, normally where the elbow and forearm muscles all connect is where it's gonna be the most tender. Some people call it tennis elbow. And then you're gonna work your way on down the forearm. Now you should be pushing. There should be pressure on this ball. You're not just sitting here rolling it up and down your arm. You want to make sure you got pressure. You can also see I'm using my leg to brace my arm against. Ooh. Find a tender area. Work that area. Continue to move it around that arm, up and down, up and down. Nice smooth strokes, smash and floss. Again, if you find a tender area, work that area. Wow. Right in there. Like I said, if you got a tender area, work that area. Trying to do loosen that tissue up. A lot of times the skin and the muscle is stuck together, and what we're trying to do is separate those two so they move smoothly. That's where a lot of the pain comes from for most people. The skin and the muscle stick together. About 15 seconds, we'll switch to the other arm. And the switch. Again, get yourself set up and down that arm. Here we go. Again, you find a tender spot, work that. Man, a couple spots are sore today. Whew. Like I said, you're not just rolling up and down smoothly. You're trying to put a little pressure on there. You're not trying to drive the ball through your arm, but you are trying to put a little bit of pressure on there so you're getting things to move around. We got about 30 seconds. And let's stop. we're going to grab that roller. We're going to work on rolling out our quads here. So if you don't have a roller, grab a pipe, PVC pipe, broom handle, any kind of a handle that's 18 to 24 inches long. I'm going to take it for 2 minutes. I'm going to roll out our quads. Here we go. Again, find a small sore area, work that area, move that around, floss it around. Make sure you get on the outside towards your hip flexor area. As you're working, you're going to go from the crease of your hip down to your knee. Don't want to roll over the knee. It sucks. Find a sore area, work that area. Sometimes you gotta twist it around. So if you do a lot of aerobic style training, this is a really good mobility routine. These rollers, they're about $10 from any big department store. Well worth the investment in the 2 minutes of time that you're going to spend on each leg. And you can do this every day. You do it twice a day if you need to. So for you guys that are runners, save yourself some money on a massage therapist by investing in one of these and a few other handy tools, tennis ball, straps. That's what this mobility stuff's about. In a couple seconds, we're going to switch to the other leg. And switch. And start it. Oh, right away. Once you start doing this on a regular basis, you're going to know what spots you need to work more. I've been doing this now about 5 years. And I can tell you, without a doubt, it's helped me in my strength training, all my resistance training, my body weight training, my flexibility. There are things that I could not do prior to starting this program that I can now. So I've been able to evolve my program as I've gotten more flexible. I've done this, again, for 5 years. And I think I've missed one day in 5 years. It's 7 days a week. It's 15 minutes of time a day. You don't have to do all three at the same time. You can spread them throughout the day. You can do one for breakfast, one for lunch, and one for dinner if that's how you want to work it. Just as long as you're getting them in. Stick to this 7-day-a-week program. I guarantee you in about 3 or 4 months, you're going to notice some significant changes. I've even noticed it when you get those slight nagging injuries, and I focus on those areas that are injured. Within a week or two, I'm back in the gym. Whereas most people down 3 to 6 weeks, usually inside of 7 to 10 days, I can go back into the gym, not quite at 100%, but probably 75%. We're going about 10 seconds. We'll be done with this one. Okay, that's Monday, week 2, mobility routine. Thanks for coming. Have a great day.